How do you prepare for these exams? Well, Kaplan has a great number of programs to help you prepare for them, and they really consist of a number of different components. The first thing is we will give you the content on the exam, and step one is a basic science exam. It tests your knowledge of the mechanisms behind health, disease, and modes of therapy. But it is important to understand that it is not a knowledge-based test. It is a test that focuses on your critical thinking skills. And students need to be able to integrate across the disciplines to be successful on this exam. It is a multiple choice question test, and you will need to answer many multiple choice questions. Step one is 322 questions divided into 7 blocks, 60 minutes a block, 46 questions per block. What that means is you need 2 skills to be successful on this exam. You need endurance. Question 322 is just as important as question 1. You need to be able to concentrate for 8 hours. You also need time management skills because you do not have 8 hours to answer a single question. Instead, you have 60 minutes to answer 46 questions, and you do that 7 times. What this means is that on average, you have 72 seconds per question. So time management is extremely important. Passing is a 188, and to pass this exam, you need to score between 60 and 70% of the questions correct. But just passing is not enough. A competitive score in the United States is anywhere from about a 220 to a 235, so significantly higher than just passing. That being said, if you pass the exam, you cannot retake it to improve your score for 7 years. So it is critical that you do well on this exam and you do well the first time. That is why Kaplan's courses always include full-length simulated exams to ensure that students are prepared prior to taking the test for the test day experience. Step 2, CK, stands for clinical knowledge. It focuses in on the clinical disciplines, and at this point, you're demonstrating to the test maker that you can work a patient up, that you can prescribe treatment and interpret data. Because of this, internal medicine accounts for over 50% of the exam. Now, as I said before, you will need to have the knowledge of all of the disciplines which are tested. But just having the knowledge is not enough. You need to be able to think critically. You need to be able to integrate across the disciplines and to apply your knowledge to a clinical setting. This often is difficult for international medical students. It's not necessarily what you are accustomed to, but that's why you come to Kaplan. We have created programs which not only cover the content, but also explain how that content will likely appear clinically. And then we give you questions which help you practice. So our students are extremely successful. And the way that they are is by mixing content review and question practice. Students will first review lecture notes, which tell them the content on the exam. Then they will go and they will watch lectures. These lectures are available in a variety of formats: online, on demand in Kaplan centers in the United States, or in live environments. During this section of your preparation, our expert faculty will take the different disciplines that you have learned and pull them together, show you how they fit together in a clinical setting, and ensure that you understand what is high yield, what will get you the most points on test day, how will the material appear on the exam. Then you'll be able to test yourself by using QBank. Over 2,200 questions organized by discipline and system with explanations for every single answer choice on step 1. And it's important that you review those answer choices because knowing the concepts and the reasons behind choosing a particular answer is really the key to being successful on this exam. Finally, as you get closer to the test, you'll be able to take quizzes under time conditions to focus on your time management skills and take full-length simulated exams to simulate the actual test day experience. Coming to the United States is a great way to prepare for these exams. Not only are you going to ensure that you're getting a comprehensive review package, but you will also become accustomed and acculturated to the United States. And knowing how to relate to program directors in interviews is a critical factor to ensuring that you match to your first choice specialty. And the USMLE is a huge part in the decision-making process. The reason is that program directors in the United States might not be familiar with your medical school. They might not be familiar with medical education in Malaysia. However, because all residents need to take the USMLE prior to starting a program, it is very easy for a program director to compare students from a variety of backgrounds. The USMLE is used as a filter, and the first step in entering this process is to get past the examination part of the filter.